When a child loses their appetite, complains of persistent stomach pain, develops white patches on their face, or constantly scratches at themselves, the underlying cause is very often microscopic. The primary entry point for this infection is the ground itself. Kids play outside, get soil on their hands, and inevitably that dirt makes its way into their mouths. Along with that soil come microscopic parasite eggs. Once swallowed, these eggs drift through the digestive tract and anchor firmly into the fleshy intestinal walls. When those eggs hatch, the worms survive by intercepting the food your child eats. They actively consume ingested nutrients, causing progressive physical damage to the intestinal lining as they feed and grow. Because of the delicate nature of a developing digestive system, any treatment to remove these parasites must only begin after consulting a licensed pediatrician. Leaving symptoms unchecked allows a hidden parasite to drain the child's internal ecosystem day after day. Stopping it requires a highly specific chemical intervention. Pediatricians frequently rely on a specific medical tool to handle this, Albas Plus suspension. It's manufactured by Prime Mankind, a detail worth verifying to ensure you have the exact product needed for the protocol. This diagram shows how the suspension works. It delivers a dual-action chemical payload, ivermectin and albendazole. These two compounds converge to target the parasite. Combining these ingredients completely paralyzes the worms, shutting down their biological functions and stopping their growth. The formula is highly concentrated, packed into a small 10 milliliter volume. It is also highly accessible, costing exactly 36 rupees and 64 paise. Securing this exact dual-action formula guarantees you have the scientifically proven tools to neutralize worms deeply embedded inside the intestinal wall. Before you administer the dose, there is a strict mechanical preparation step you have to follow. You must shake the bottle vigorously. This ensures the ivermectin and albendazole are evenly distributed throughout the liquid, but you have to do this carefully. The liquid is contained within a highly fragile glass bottle. Dropping it means losing the entire single-use dose instantly. If the vial shatters, the eradication protocol fails before a single drop of medicine reaches the child. Once safely prepped, the amount you administer depends entirely on the biological age of the child. For a child over 2 years old, the protocol calls for the complete 10 milliliter volume, which equals exactly 2 standard spoonfuls. For a child under 2, the liquid must be strictly subdivided based on your pediatrician's specific calculations. The timing of the dose is just as strict. You must administer the medicine at night, right before the child goes to sleep. While the child sleeps, their digestive system rests. This allows the active ingredients to flood the intestinal tract unobstructed, hitting parasites with maximum lethal effect. Giving the dose at night ensures the chemical attack perfectly aligns with the body's natural resting state. The next morning, the host's natural digestive clearing cycle flushes the neutralized parasites completely out of the system. The immediate result is relief. The persistent stomach pain stops because the physical damage to the intestinal wall stops. Following that, normal appetite returns. The child begins retaining their caloric intake instead of losing it to the worms. Remember, maintaining a child's health requires precision. Always keep open communication with a pediatrician for any ongoing care. If you know caretakers dealing with these exact symptoms, share this protocol with them. A precise pharmacological intervention, handled carefully and timed for the night, permanently breaks the parasite's life cycle and gets your child's health back on track.